Hello and welcome to Doc Talk. I'm Tara Perry, the race director for the Community First Fox Cities Marathon presented by Myron Construction. And welcome to our Doc Talk series. This is your chance to ask questions of experts from all of our medical sponsors. That includes Ascension, ThedaCare, Orthopedic Sports Institute of the Fox Valley, and OSMS. And so we're very excited to welcome two of our experts from ThedaCare Orthopedic Care today from Appleton. Joining me, I have Dr. Ryan Wagner and athletic trainer Briana Bosquez. Hi, guys.
Hello.
Hi. All right. Well, thanks so much. Like I said, we're going to keep this pretty lighthearted to ask some questions. We know that people are starting to train for the fall marathon, for the half marathon. So, we're going to start with some areas of expertise of our two guests, and we're going to talk knees, I think, for a little bit today. So if you guys could just hop in and tell me, what are some common things that people can be doing to prevent injuring their knees in general?
Yeah, I think knees in general are, one of the most common injuries for runners. And I think injury prevention is key, whether you're doing marathons or any sports in general, to really be cognizant and listen to your body. I think, a few things that come to mind with injury prevention is one, warming up. You want to make sure that you do a good amount of stretching before you run. You don't want to go out there and just, give it 100%. Right away. So I think, a gradual increase is always ideal. Sometimes we think about, running, especially training for a marathon, people like to really, exponentially increase their miles. And sometimes people do it too fast when they're training. So I think sometimes taking a break can be very helpful. Which seems kind of counterintuitive, but allows, for a period of rest and allows your body and muscles to recover. Other things I think about, so watching people's strides, sometimes overstriding can kind of cause, significant stresses, whether it be to the muscles, the bones, or soft tissues of the lower body. Sometimes shortening, your stride can help take some of the stresses and reduce kind of the impact to the lower extremity. Other things, just equipment wise, running shoes. Sometimes we recommend, changing your shoes every 400, 600 miles. Everybody's a little different. But, that's usually a kind of a non-written rule that we like to stick to. So sometimes, pain can be a sign that your running shoes are getting worn out. So be very cognizant of that. And then, icing can also help, multiple times per day.
I guess the other thing I would say to piggyback off of some of that is a little bit of cross training and also strengthening all of the other muscles in your body. So sometimes runners think, I just have to run to get better. But if you're having some type of injury or your knees are starting to hurt you in this particular case, you can work on strengthening your hips, strengthening your core, strengthening your arches and your calves. Anything that you can do around that joint is just going to help you stabilize that joint, especially as you become fatigued in your longer runs.
Really interesting. So are there cross-training, like areas of cross-training that you would recommend? Like, if they are having a knee injury issue, is there one cross-training that's better than others, or are they kind of all the same?
So I think it kind of depends on what type of knee injury that you're having. And that's something you can kind of talk to some of your healthcare professionals about, because you might be able to bike with particular knee injuries, but that might flare up other ones. So then you can look at, swimming, which is a really good builder of your cardiovascular health. It can help keep your endurance up, even if you're injured for your training. Other ones are elliptical. You're not bending as much in the knees on that one. So that one can help you cross train as well.
I also think yoga. I know yoga is very popular. So I think yoga is a great option as well. So.
Yeah, absolutely. Yoga is good for the core for sure. That kind of, all things start with the core, right?
Yeah, for sure.
So when people come in with a knee injury, do you see some things that they did leading up to it that are a common maybe misstep that they've taken in their training? I know from experience, I didn't, go from one side of the road to the other. And so I had some, exterior problems with one of my knees. So I learned the hard way that you should really vary the side of the road that you're on because of the grading issues. Do you see any other things like that that are common that people could maybe avoid if they knew ahead of time?
Yeah, I think one of the things is just overuse in general. People, tend to, like we talked about, especially with marathon runners, really exponentially increase their miles, and listening to your body very closely. So if you have discomfort or pain, a lot of people feel like they have to, push forward and push through it. And kind of our recommendation would be that it might be helpful to kind of take a day or two off and listen to your body and kind of let that pain and discomfort subside, and kind of see where it's at, instead of really pushing through it, feeling like, hey, I have to finish these last 2 miles of my training run, to get all my miles in. It might be more advantageous to take a break and rest.
The other thing I would say is not giving yourself enough time to train prior to the race. So some people are like, oh, we have this race coming up in 1 month. I'll be fine. I'll start racing. I'll start training now. So you're just jumping into it too hard, too fast, and you're putting a lot of strain on your body. So give yourself enough time prior to race to train your body.
Yeah, and I think that's a great point, Briana. And I think one of the other points is that in Wisconsin, we don't have a advantageous climate all year round, so people might take time off in the winter. I mean, you can run inside on treadmill and things like that, but I think it's a little different when you're outside running on pavement and trails and things like that. So trying to keep up year round instead of just running during the warm months. So kind of that year round training, I think, can really help decrease one's risk for injury.
Yeah, I couldn't agree more. We start our training runs every year, the end of May for the marathon and the half marathon, just so that people are ramping up in a slow way and in a safe way. We also, encourage them, get some base miles in before you really jump in, even to a training plan, because to your point, having that year-round focus on at least staying in it will help you out. So that's excellent points, you guys. Anything else that you can think of that would be really beneficial around the topic that we've been covering today?
Just injury prevention in general. I think some things that might get overlooked is just equipment, as I kind of mentioned earlier. Making sure that you have properly fitted shoes, that you're changing shoes every so often when you need to, and when you're running the marathon, obviously well hydrated. Nutrition's a big factor. You want to prevent heat stroke if it's a very hot day. So those are all things we worry about. Simple things, wearing sunscreen. Some people like to run with a hat and things like that. So, I think the little things like that can also, optimize one's performance in a marathon and help them, get to the end and, reach their optimal time if they are, going for time, or just finishing type of thing. So.
Yeah, I couldn't agree more. And sometimes I say, set several goals for yourself, right? So you can have here's my ideal finish time goal. Then there's my I just want to finish goal, because either way, you just did something completely amazing.
Yeah, that's awesome.
And I think one thing with knees, it's kind of harder to push through, I would think, on injuries, because it's going to tell you it's time to stop. So when should people really consider coming in and having it checked out? Like if they followed the advice that we've already talked through and it's just not going away, is that the time they come in, or should have they been in a long time ago?
I think it's dependent on each person. So I'm not going to say you have to wait until you're limping to come in, because if you are planning on a big long race like this and you want to be proactive about it, come in sooner when you start to feel things, so that we can address the underlying issue and what's going on. A lot of people wait until they are at that limping stage because they're like, I can't push through this. So I don't think there's exactly a right answer there. I think it's all dependent on the person and what they think they need.
Yeah, I think that's a great point. I think the biggest factor is almost getting ahead of the 8 ball before it really becomes too far down the line where it might affect your race and you can't heal properly before the race comes. So I think being very proactive about it and coming in sooner than later can be very beneficial in the long term. So.
Right. So be proactive, listen to your body. Don't
Yeah.
let it drag on because, speaking from personal experience, I probably should have went in earlier because then it was a nagging issue, for the rest of my training for my first marathon. So, it's kind of that live and learn experience. So it's nice to know that you guys are there to help us all out as we navigate some of these training issues.
Yeah, definitely here to help people, and I think that that's what we look forward to the most is unfortunately having to see them in clinic because they're injured, but getting them back to their optimal health and being able to achieve what they want to achieve. So
yeah, I can imagine it's a very rewarding job, and I think you both indicated in our earlier conversations before this taping that you went into it because you love athletic performance and helping athletes get up to, their optimal performance. So I just really appreciate you guys taking time today. So I think I'm going to wrap it up, but if there's any parting thoughts that you guys want to share before we do that, I'll open the floor back to you guys.
Oh, I just want to thank you for allowing us to jump on with you today and kind of go over some things. So.
Yeah, we really appreciate it. So we're here if anybody needs anything, and happy to help out. So thank you so much.
Awesome. Well, thank you so much. So thank you guys. Thanks everybody that's watching today. Please know that we're going to keep doing these Doc Talk training tip videos so that we can get our experts out in front and use their knowledge and expertise to help you guys through training. So feel free to post any of your questions in the comments along with this video. You can shoot an email to info@foxcitiesmarathon.org. We'll be continuing to share these on our social media sites, so that's where you can find them. You can also find them on our website, which is foxcitiesmarathon.org. So thanks again for joining us today, and we're really looking forward to seeing you at our weekend of events in September.